First of all, thanks for having me on. Secondly, I'd say that what we're watching is disaster unfolding. And it's a man-made disaster, unlike COVID, which hit us hard. This is one that's being made in Washington, D.C. And the reason you see California, Oregon, and Washington State moving forward is because we're not going to wait till the disaster hits home. We're going to prepare. There is no reason why, as we approach the fall and winter seasons where we know flu, COVID, RSV hit hardest, that we should be unprepared because the CDC is being dismantled one health professional at a time by the secretary. It's not the way you do health, and we're not going to watch.
Earlier this week, you had Senator Bill Cassidy, who's the chair of the Senate Health Committee, who, as you know, played a critical role in the confirmation of HHS Secretary Kennedy, said, oh, you know what, I think actually we need more oversight here. We need Congress to do their job. You served in Congress. You ran HHS. What would appropriate congressional oversight look of HHS in this moment?
Oh, I just remember when I was secretary, I would get called up quite a bit to Congress, both the Senate and the House, to talk about everything we were doing. And it's good that this hearing was held today, but that's not enough. We've seen disaster after disaster unfolding at HHS, and to only now have this hearing, it's overdue. And I would hope that these senators on a bipartisan basis take action, which seems to me to be the most appropriate thing to do, since it sounded like the secretary was doubling down on exactly what they're doing, which is putting America at risk. So I hope the senators are now awake and willing to take action.
You know, sir, I just call me skeptical of the skepticism. I listened today and I heard Republicans that I've known for a number of years sit there and rebuke the Secretary of Health and smack him on the hand about this, that, and the other thing. And then you've got, headlines following today's performance, noting that, Senator, for example, key GOP senator, in this case, Senator Bill Cassidy, declined to elaborate on planned oversight of RFK after CDC exodus. So in the hearing, he's like, I'm going to do oversight. I'm going to do oversight. And the condemnation and the concern, I speak for the people. I'm just not convinced because he's self-saying people put him in the job. They put him in the job. They were warned. People forget the man's family told them, he crazy. Don't do this. Don't put him in this job. It is not good for the country's health. So here's my question. What should governors and what should states expect of these senators at this point? What is it that families and communities expect of them? You're running for governor. What is your expectation of the senators, even if they don't represent your state, all right, wherever they happen to be, to deal effectively with not just oversight, but making sure this man doesn't harm the American people with bad health policy?
Michael, representation is what we should expect from these senators. There are millions, tens of millions of people that are represented by each of these senators. And for them to not represent the health and well-being of their constituents is dereliction. We know that at this stage, CDC is not prepared to be the glue for 50 states when it comes to some catastrophic pandemic the way we saw with COVID. We know that losing some of your highest level health professionals and scientists is going to leave you at a disadvantage. And so at this stage, those senators should act. It shouldn't just be a hearing. They should take action. From what I saw, and I think the senators saw the same thing, you have a Department of Health and Human Services which is not protecting the people. Take action. You represent tens of millions of Americans. Take action. Make it right. It's time to hit the reset button on HHS.
That it is. And a big reset button it is. Former HHS Secretary Javier Becerra, thank you very much. Joining us now is former director of the National Center for Immunization and Respiratory Diseases at the CDC, Dr. Dimitris Daskalakas. He resigned from the CDC last week, and MSNBC medical contributor and former Obama White House policy advisor, Dr. Kavita Patel. Thank you very much for being with us.
I said, I think the last time Dr. Patel was here, Dr. Dimitri, I said, someone said earlier today that it feels like that they're trying to kill us. I currently now feel like they are trying to kill us with the anti-vaccine rhetoric, the anti-vaccine policy. I am concerned about the health, not just of our children, but of the country. Am I being dramatic, Dr. Dimitri?
So thanks for having me on. I don't think you're being dramatic. I mean, I think if you see my resignation letter, I wasn't subtle about my concern that we were moving into a territory where there's active harm that's being created for the health of America and for the security of the country. So I would say that not only is it worrying about your health and your friends and family's health, but also about the health security of the country, which is also being compromised by this ideology permeating science.
Dr. Patel, we hear a lot about climate refugees. Do you think we're getting to a point where you're going to have vaccine or public health refugees? People have to leave their state because it's no longer safe for them to be there?
They're already trying to do it because of the restrictions that were put by the FDA on the label, where you had to be, if you were a healthy adult, you really couldn't get the vaccine, or you might not be able to get it covered by insurance. So people have been asking, well, should I go to Canada? Should I go to another state? Massachusetts just put in, states, as you mentioned, are allowing now for any adult or any child. We don't have a vaccine available for 6 months to 5 years right now because they're waiting for that CDC committee to meet on September 18th. So, yes, if you're worried, if you've got a child at home that's immunocompromised or you're a pregnant woman, yes, you absolutely are thinking about going someplace else right now.
Dr. Dimitri, a lot of this, and I raised this with Mr. Becerra before you came on, about how the Congress, how the Senate is responding to all of this, and how they should respond in light of the health needs of the country. You've been inside the room. You know how these things come to matter for families and communities out there. What would you say to them, pretty much to Dr. Patel's point, parents should do in the face of a Congress and an administration that clearly does not give a damn about the health of their kids because they're not requiring the vaccines that would prevent chicken pox, measles, and other communicable diseases that oftentimes strike in large waves across the country if they've not been handled. And we've handled them in the past. Now we don't. So how do you talk to parents about all of this?
Yeah, I think that what I would say to parents as a physician is, if you can't trust the information coming out of the health authority of the United States, you need to trust your pediatrician and you need to trust your primary care doctor. I think at the end of the day, anyone who is trying to disturb the relationship between a parent and their pediatrician, as the secretary is trying to do, you really need to question their motivation, because I think that is one of the most important relationships for a parent, is that with their pediatrician. So if there's no trust in the secretary, which I don't have any trust in the secretary in the vaccine space, then you must trust your pediatrician and the organizations that represent them that are providing them guidance that is evidence-based, which is different than the guidance currently on the CDC website.
How exhausting, though, that we're shifting that responsibility to doctors, right? And that they are now the ones who are going to need to hold the line on public health.
And we haven't forgotten the $1 trillion of cuts. I mean, I would love for everyone who needs to get to see me to be able to see me, but we've cut people off the ranks of Medicaid, off the Affordable Care Act. So all that access, we are simply not making America healthier again. We're making us sick. Not again, but we're taking us back to 50s. I can't even believe what's happened. I didn't think 2025 would look like this.
I mean, and to be very clear, anti-vaccine rhetoric isn't new. I mean, ever since vaccines became available in this country, there's been a debate about it. But at one point, I thought we were all at least on the same page about what we need to do for measles, polio. That public health sometimes outweighs if you really don't get stuck with the needle or not. But now the anti-vaccine rhetoric, the fringe of this country, is at the center and has the full force and weight of the government behind them. I guess my concern is RFK Jr. is not a doctor, but there are some doctors somewhere that believe a piece of what he believes. There are people in high-ranking places that believe some of what he believes.
There are a lot of Instagram influencers.
Come on the Twitters and the TikToks.
That's right.
How can people parse through that? We're telling them now, believe your pediatrician, believe your doctor. What if your doctor is one of the crazies.
Right. I think Dimitri's right about kind of a sacred relationship, but I would also say, I think underline what Dimitri said is that the organizations that represent us, American Academy of Pediatrics, American Academy of Family Physicians, American College of Physicians, by the way, which the secretary took pot shots at, saying that they were all supported by pharma, which could be nothing further from the truth. But those organizations have been clear in putting out guidance. So I think you have to trust and verify as well. And I think that's unfortunate that in an era where I would love to be having conversations with people about how they can improve their heart health, how they can avoid disease, I'm trying to tell people, here's why I don't think you should follow that website, and here's why I think that you should get your measles shot. And that's literally a conversation that I've had, because now the opinion is driving the science.
Right.
That never used to be. The science would drive how we talked about this and our opinions. It's the opposite.
You're going to enjoy this one, Dr. Dimitri. I want to play for you where Senator Lujan asked about your claim that, you weren't allowed to brief RFK. Let's take a quick listen to this.
Dr. Daskalakis, who recently resigned as director of the National Center for Immunization and Respiratory Diseases, his resignation letter stated he and his team were never allowed to brief you. I'm curious who you're listening to, since it's clear you're not listening to qualified experts like Dr. Daskalakis. Can you give the committee the name of the person?
I don't consider Dr.
Mr. Secretary, the question that I have for you is, can you give the committee a name of who you're getting briefed by?
I'm getting briefed by all the time by CDC.
Just a name.
Dr. William Thompson's one name.
So the interesting part about that, may be referring to Dr. William Thompson, a former CDC whistleblower who claimed in 2024 to have evidence that the CDC altered the rules of data collection for a study in order to omit data which would have shown African-American boys had a greatly higher incidence of autism than MMR, measles, mumps, rubella vaccination, according to advocacy groups in the vaccine community. I wanted to give you a chance to sort of respond to that. Because, he clearly, it seems to me almost like Dr. William Thompson's name just kind of popped in his head. He was like, okay, I need a name, so let me find one. But talk about what you stated about the fact that you could not brief him, and that led to a lot of where we are right now.
So to be clear, Dr. William Thompson does not work in the immunization space at CDC in the center that I left. He is not in the National Center for Immunization and Respiratory Diseases. He is not someone who has the background in the infections that I spoke about that we've never briefed the secretary on. So I don't know who briefed him on measles. I don't know who briefed him on flu. I don't know if anyone's ever briefed him on polio. So the bottom line is that he has not been briefed by anyone who is a senior member or an SME, in fact, from the Immunization Center at CDC. So claiming otherwise is untrue. I can tell you, you just talked to former Secretary Becerra. I've briefed him several times, just to make the point that it is highly atypical that CDC experts aren't briefing the secretary directly about critical healthcare issues and health issues. So I don't know what the secretary was talking about, but quite certainly he did not tell the truth around who was briefing him and that those people were from the National Center for Immunization and Respiratory Diseases. That was false.